This video is the product of the Functional Cranial Release Research Institute. For difficult neurologic conditions that no one seems to have answers for, visit functionalcranialrelease.com. What happens with the jaw is that we lose something called proprioception, which is knowing where our jaw is. And the very smooth movement and the detailed movement of where your jaw is and where they fit with your teeth is called proprioception. And so when you have better proprioception, you're actually going to be gentler on your jaw joint because you know exactly where it is. So I'm going to show you some exercises that are going to work on that aspect of your jaw. Okay? So what you're going to do is you're going to take a couple of toothpicks and you're going to be putting them kind of like in the top of the front tooth, and then the long tooth. Okay? And so what these are going to do is they're going to represent something for you to look at to know exactly where your jaw is in relationship to your maxilla, which is the top area. Okay. And so once these toothpicks are inserted, what you're going to do is you're going to make movements up and down, and what you're going to be looking for is you're going to either see it make not a smooth movement where it may be jerky, or you may see like some S shapes. And what you want to do is go slow and really concentrate on having that go exactly in a vertical, and then we're going to do it also in exactly in a horizontal. And then you can do it oblique. So you can do oblique movements with your jaw. Okay. Kind of like an upside down V, one way and then the other way. Okay. More advanced work, you can even be writing your name. And so you could be doing the alphabet. The whole purpose of this is going slow where you're able to keep total control of that toothpick. So let's go ahead and watch you. Turn this way. There you go. Okay, so you're going to go slowly open. Right there at the end, just to get that.
Great, it feels just weak at the end there.
Trying to make it go smooth through that last bit too when you're just closing it. And going super, super slow. Just really watching that. Yeah, keep it going smooth. You notice when you just kind of like relax and let it close, it kind of starts to make some moves. Touch the tip of those. Yeah, and then try to touch the tip and then just open up from there. Barely touch the tip and then open up from there.
It just slides off. Under.
Okay. Now I want you to try and bring it so the toothpick, so your mouth can be slightly open. Okay. Bring it so the toothpick is right at the points are right next to each other. Okay, and then what I want you to go open a little bit more. Yeah, there you go. And then you're going to bring the bottom jaw and you're going to bring it horizontal back and forth. Now at any point, if some of these range of motions at the end start to give you some soreness, you don't want to go that far.
Okay.
You know, you want to stay within limits that are comfortable for you.
Mm-hmm.
Now try taking the lower jaw and try doing a circle below the top. Whoa.
You see that?
Yeah. Lift this up a little bit. Give you a little bit more.
Oh, wow.
So the key with this is not to try to do a lot at one time,
Mm-hmm.
but the repetition of doing this a little bit each day
Right.
will start to build the nerve cells, you know, in your brain that are responsible for knowing where your jaw is and controlling the fine motor skills. You know, those will start to really regenerate
Right.
if it's just done a little bit more often versus a long duration.
Right. Huh.
So now try to do an oblique movement where you just come off to the side.
Uh-huh.
Try to go at a 45-degree angle down. There's a little bit of shift there,
Mhm.
and then go the other way. Okay. So more of a 45, nice and smooth and slow. Yeah. So there's a lot of room for improvement here.
Right. Yeah.
Excellent.
Hmm.
You got the idea?
Yeah, definitely.
Good.
Hi, this is Dr. John. Thanks for joining me. If you or a loved one suffers from difficult neurologic conditions that no one seems to have answers for, send them to functionalcranialrelease.com. You can contact me by phone or email me at askdrjl@gmail.com. And remember, if healing is possible, consider it to be within your reach. Bye for now.
functionalcranialrelease.com